infectious disease course. The lecture is Principles of Infectious Diseases. The contents of the lecture, it will include the definition, types of infectious agents, ways of transmission of infectious diseases, pathology and pathogenicity of infection, investigations, the ways for prevention and control of infectious diseases. What about the objectives of this lecture? At the end of this lecture, you will be able to define infection and infectious disease, differentiate between infection and colonization, know the types of infectious agents, understand the concept of a human microbiome, list the main types of bacterial agents, elicit the important investigations, and recognize important preventive measures. Here are some definitions about infection, colonization, latent infection, infectious disease, and pathogens. First of all, infection. What do we mean by infection? The term infection is often used interchangeably with infectious disease. But not all infections are infectious. That is to say, transmissible from person to person. So not every infectious disease is transmissible between human beings. For example, rabies. On the other hand, infectious diseases transmitted between hosts are called communicable diseases, whereas those caused by organisms that are already colonizing the host are described as endogenous. So infections that arise from the normal human commensals are called endogenous infections. What about the infectious agents? The concept of an infectious agent was established by Robert Koch in the 19th century. What are the characteristics of for organism to be an infectious agent? Number one, the same organism must be present in every case of the disease. So the disease should be manifested by the same organism. Second one, the organism must be isolated from the disease host and grown in pure culture. The third concept, the isolate must cause the disease when inoculated into a healthy, susceptible animal. And the last and the fourth principle is the organism must be re-isolated from the inoculated diseased animal. So these are the main characteristics of infectious agent. So that any organism that fulfills these criteria, we will call it an infectious agent. So how the disease will occur in respect to infectious disease. The important for this disease is what we call it the chain of infection. It will be manifested as initial an infectious agent. This infectious agent must have a reservoir in the environment, so it can cause the disease. This reservoir will will exit from the reservoir and enter the susceptible host, for example, a human, and then the human being will transmit the disease to others by many ways of transmission, for example, handshaking, sneezing, and then it will exit the other susceptible host, for example, by droplets, by incisions, by injectable agents, and there must be a susceptible host for the infectious disease to occur. So this is the chain of infection. These chains of infection were multiple. You can either vaccinate the susceptible host, or the reservoir, and etc. So how bacteria are identified? This is an example of infectious agent bacteria. These are one of the famous organisms that cause infectious disease. Bacteria. How bacteria are identified? There are multiple modalities to identify the bacteria. For example, the commonest one is by using the gram stain, which is the famous stain. And according to this gram stain, we classify the bacteria into either a gram positive or a gram negative, or by using the microscopy and the morphology of this infectious agent, the bacteria, either cocci or bacilli, or according to the presence or the absence of capsule of the bacteria, or according to the morphology in association with other cells, either in clusters, for example, Staphylococcus aureus, or pairs, for example, pneumococci, or according to the colonial characteristics, for example, the colon shape or the color, or according to the culture media, for example, as you know in the bacteriology, the beta hemolysis of the blood agar in hemolytic streptococci. So it will cause hemolysis of the blood agar. This is a useful way to classify bacteria according to the hemolytic criteria. Or according to the cultivation criteria, for example, according to the use of atmospheric requirements, for example, either strictly aerobic, requires oxygen, or strictly anaerobic, which requires the absence of oxygen, or between them, what we call facultative aerobes, which may grow with or without oxygen, or microaerophilic, which require reduced oxygen tension in the culture. Or according to the biochemical reactions, there are multiple biochemical reactions that can recognize bacteria. For example, the ability to ferment or hydrolyze various biochemical substrates, or the expression of enzymes, oxidase, catalase, or coagulase. For example, Staphylococci can be categorized into either staphylococcal coagulase positive Staphylococcus aureus or coagulase negative Staphylococcus aureus. Or according to the motility of the organism, either motile or non-motile, or according to the antibiotic susceptibility. For example, penicillin sensitive pneumococcus or penicillin resistant pneumococcus, or commonly Staphylococcus, methicillin resistant Staphylococcus aureus, or methicillin resistant Staphylococcus aureus. Or sometimes this is a new classification according to the matrix assisted laser absorption, matrix assisted laser absorption or ionization time of light mass spectrometry. This is a new type of isolation of the organism, which is a rapid technique, which that identifies the bacteria and some fungi from their specific molecular composition. So we can identify bacteria, not the usual classification, either gram stain or morphology, but using molecular composition, or according to the sequencing bacterial ribosomal RNA gene, the 16S ribosomal RNA gene, which is a highly specific test. So each bacteria has a fingerprint of its own fingerprint that can identify these types of bacteria, or the whole genome sequencing. The whole genome sequencing is also highly specific, and it's potential to provide rapid and simultaneous identification, sensitivity testing, and type of organism from pure culture. So this whole genome sequencing is an evolving type of identification of bacteria, and it's likely to replace many other technologies described in the previous years, like gram stain reactions or atmospheric requirements. And it is very high specific, and but unfortunately it needs sophisticated tools to demonstrate this whole genome sequencing. So as you know, I think you are familiar with this picture. This is a blood agar, which shows a gram of gram beta hemolytic group of streptococci, which cause this hemolysis, and this is transparent according in comparison to the blood agar, because as the bacteria grow, it will hemolyze the RBC and will reveal this transparent lines. So this is what we call it beta hemolytic streptococci. This is way to identify bacteria. This is example of what? Example of the pattern of hemolysis and the morphology. What about the normal microbial flora? As you know that the human body is colonized by a large number of microorganisms, collectively called the term the human microbiota. This is the new term. The normal microbial flora, the new term for this normal microbial flora, which we call it the human microbiota. So these are colonizers. As you know, as you see this picture, there are millions of types of normal microbial flora, and it will inhabitant of the surfaces, the outer surfaces and the inner surfaces of the human body. For example, the scalp or the skin and the gut. For example, the inner part of the body. You are not required to memorize all these types of organisms, just to have a look. So every part of the human body have these commensals and to differ from type to type, from side to side. For example, the oral cavity is colonized by many organisms. For example, oral streptococci and anaerobic, for example, gram-positive bacilli, and etc. The large bowel also, it is a site for heavily colonized by many bacteria. For example, Enterobacteriaceae, for example, E. coli. These are normally present in the human large bowel, but it is not present in the normal renal tract of the human being. So if it is present, it will not we will not classify it as a normal microbial flora. We will classify it as pathogenic bacteria. So the normal microbial flora, the GI tract and the mouth are the two most heavily colonized sites in the body, and their microbiota are distinct in both composition and function. Knowledge of non-sterile body sites and their normal flora is required to inform microbiological sampling strategies and interpret culture results. So if we have a culture for a stool, it differs from culture of blood in the terms of the normal flora. The blood shouldn't contain these organisms. And on the contrary, if you culture a stool from a patient, you may notice a growth of normal microbial flora. For example, E. coli. The normal microbial flora have many benefits to the human being. For example, the lower gastrointestinal tract bacteria synthesize and excrete vitamins, for example, vitamin K. And colonization with normal flora confers colonization resistance to infection with a pathogenic organism by altering the local environment. And this is an example when the patient or a person taking antibiotic for a reason or another, and he's developed diarrhea. This antibiotic will disrupt the normal flora because the antibiotic couldn't differentiate between the normal microbial flora and the pathogenic bacteria. So it will kill the normal flora, and this human being will lose this colonization resistance, and it will make the pathogenic organism will be flourish and grow, causing a human disease. So this is one mechanism that the normal flora confer colonization resistance. The other mechanism that by producing antibacterial agents, for example, bacteriocins, which are small antimicrobial peptides or proteins, or it may produce fatty acids and metabolic waste products, or the most important one, by inducing host antibodies that cross-react with the pathogenic organisms. For example, the E. coli in the bowel will stimulate the the inhabitant beta lymphocytes, the B lymphocytes that are present in the germinal centers in the small or the large intestine. And these antibodies against the normal microbial flora, for example, E. coli, will cross-react with the pathogenic E. coli, and it will confer immunity to the human being. Conversely, Normally, sterile body site must be kept sterile. For example, the cerebrospinal fluid, it should be sterile. Any organism that grow in this fluid, it will be considered not normal human, normal microbial flora, but it's called pathogenic organism. The normal flora contribute to endogenous disease. So the normal flora is not always normal, maybe abnormal, maybe abnormal in specific circumstances. How? The normal flora contribute to endogenous disease mainly by translocation to a sterile site. For example, in a patient with a chronic liver disease who have ascites, the translocation of bacteria from the bowel, for example, the normal microbial E. coli, the normal microbial flora, which we call the Escherichia coli, when it is translocated inside the acidic fluid, and we culture this organism, it is no longer considered as a normal microbial flora because it should not be present in the acidic fluid, but it should be present in the large bowel, not the acidic fluid inside the peritoneal cavity. So we call it not the normal microbial flora because I identify it in the abnormal site, that it should be sterile. On the other hand, the excessive growth of normal microbial flora, it was also called the pathogenic. For example, in diarrheal overgrowth. When the colony count for the E. coli, it will exceed its normal limit, it will cause diarrhea, and we call it overgrowth diarrhea. So excessive growth at the normal site, which we call it overgrowth, can also cause disease. What are the examples of this overgrowth? Example by dental caries, vaginal thrush, and blind loop syndrome. All these are examples of overgrowth of normal human. Normal flora also contribute to disease by cross-infection. How? In which organisms that are colonizing one individual cause a disease when transferred to other, more susceptible individual. So the normal flora of one human, it may be abnormal to the other human. For example, in case of Staphylococcus aureus, that will cause diarrhea in one individual when it swallows this organism by contamination of surfaces. Or when a patient developed diarrhea, he received antibiotics. And this organism, when shed and swallowed by another host, this E. coli that are exposed to antibiotics will become pathogenic when swallowed by oral fecal route into other human being when it is immune compromised. For example, in a patient who has a chronic kidney disease or an HIV patient. So everyone has its normal microbial flora. So it is a fingerprint, like fingerprint. So it is what you call it a cross infection, and commonly occur in hospitalized patients when a patient is hospitalized and exposed to organisms that are already present in the hospital. And it causes, for example, an outbreak of diarrhea among hospitalized patients who are exposed to a more pathogenic bacteria. So here is the importance of limiting preparations of the microbiota by antimicrobial therapy, which is increasingly recognized. So antibiotic therapy will alter these normal microbial flora and will lead to growth of more pathogenic bacteria. What about the probiotics? Probiotics are microbes or mixtures of microbes that are given to a patient to prevent or treat infection and are intended to restore a beneficial profile of the microbiota. So these are normal, so these are useful microbes. The aim of it to prevent or treat infections and to restore the normal profile of microbiota. That was altered by exposure of the human to antibiotics. So this is the idea of treatment with the probiotics. So when the pathogen that invade the host, what about the interactions between host and pathogen? So the organism that be able to cause disease, we call it a pathogen, and it has a pathogenicity potential. What are the types of pathogens? It's either primary pathogens, so it will cause a disease in a proportion of individuals to whom they are exposed, regardless of the host immunological status. So whether it is immune competent or immune compromised, it will cause a disease. This will what we call it a primary pathogen. And the pathogens have different disease manifestations according to its what we call the virulence. So some organisms are very virulent, for example, Staphylococcus aureus, whereas other organisms are less virulent, for example, Staphylococcus rigidensis. Another type of pathogens, what we call the opportunistic pathogens. So these pathogens cause disease only in individuals whose host defenses are compromised. So these pathogens will not cause disease in immune competent host. For example, by an intravascular catheter, which will disrupt the bloodstream and the skin, or when the immune system is compromised, for example, in a patient taking steroids for long duration, or has, for example, an advanced HIV infection, or by genetic susceptibility. There are many diseases that will cause immune compromise, genetic diseases that will cause immune compromising state. So what we learned today, the primary pathogens or the opportunistic pathogens. The difference in the host, the immunological status of the host. What are the characteristics of successful pathogen? How the pathogen will cause a disease in the susceptible host. It should compete with the host cells and colonizing the flora by various methods. It should have a motility, use adhesins or form biofilms. For example, in a patient who has a Foley catheter inserted in his urinary tract. So if the pathogen can create a biofilms around the Foley catheter, it will cause successful infection and disease. Or produce toxins. For example, in Staphylococcus, toxic shock syndrome, or they survive the intracellular environments, including after phagocytosis by macrophage. For example, in Mycobacterium tuberculosis, which will survive then the macrophage inside the alveoli of the lung. And keep in mind that not all the pathogens have all these criteria. Many of them will have one criteria or two criteria. For example, in Mycobacterium tuberculosis, it will use this survive inside the macrophage, but it definitely will not produce toxins. And it will, the Mycobacterium tuberculosis, it is non-motile. These are the types of exotoxins-mediated bacterial diseases. So diseases will be mediated by exotoxins, but not the organism. So, for example, Clostridium difficile by itself will not cause a disease, but it will produce exotoxins that will produce pseudomembranous colitis. And another example is Clostridium botulinum, and it will produce botulism, not by the organism, but by its mediated toxins, and etc. For Vibrio cholerae, it will cause cholera, or Corynebacterium diphtheria, it will cause diphtheria. Enterohemorrhagic Escherichia coli, it will cause hemolytic uremic syndrome. Staphylococcus aureus, it will produce toxin that will cause necrotizing pneumonia. And the disease tetanus, the famous, it will be mediated by the powerful tetanus plasmine, which is a tetanus-mediated toxin, or toxic shock syndrome, for example, which is produced by Staphylococcus aureus or Streptococcus pyogenes. So these are examples of toxins that mediate the bacterial disease. What about the host response to the invading pathogen? As you know from the immunology, that the host response have two types of responses, either the innate immune response or the adaptive immune and inflammatory responses. Many diseases, for example, that maybe protected the human being by the innate immune system. For example, the normal skin or the presence of immunoglobulin A in the saliva and will prevent infection. So these are the innate immune response, or the presence of circulating macrophages inside the alveoli of the lung. This will engulf the organism. On the other hand, the adaptive immune response, which is mediated by the T and B lymphocyte, will produce the adaptive immune system and will cause release of cytokines, for example, gamma interferon, in a case of Mycobacterium tuberculosis. So this is an example of adaptive immune response. Next one is the pathogenesis of infections, how the disease will occur in the human. When the organism or the pathogen invade the host, there are certain manifestations. The harmful manifestations of infections are determined by a combination of the virulence of the organism and the host response to infections. So the highly virulent organism and the more robust host response, it will cause severe manifestation. So any break in this balance will modify the picture of the disease. So despite the obvious benefits of the intact host response, an excessive response is undesirable. As for instance, the immune reconstituting inflammatory response, the IRS, which occur in a patient with an HIV infections and have a good immune response. So it will be an excessive disease. And another example is the development of adult respiratory distress syndrome in response to, for example, influenza infection. So influenza it may be have different manifestations from individual to other. When the patient have excessive immune response, this immune response will destroy the normal host response. So the patient will develop an ARDS picture and manifested by hypoxemia and respiratory failure. So an excessive immune response will be unfavorable to host and even may kill the host. And another example, for example, hepatitis A infection. Many individuals have subclinical manifestations, or even that it may develop jaundice, vomiting, and it will subside within the next several weeks. Some hosts will develop severe liver failure due to robust inflammatory response mediated by the host cells, and this may kill the patient due to acute liver failure. So the harmful or excessive response, it will be also favorable. What about the febrile response, which are one of the common manifestations of infection in infectious diseases? The febrile response is usually mediated by the pyrogenic cytokines, for example, interleukin 1 and interleukin 6. And their ultimate effect is to induce the synthesis of prostaglandin E2. This prostaglandin will bind to the preoptic nucleus of the hypothalamus and will cause the core body to rise, the core body temperature to rise. For example, from the normal 36.9 to the, for example, to 38. In response to this upset in the hypothalamic thermostat, the body will develop rigors. So what do we mean by rigors? Rigors are a clinical symptom or a sign if they are witnessed. So the patient may describe rigors, or if you see it in the clinical examination. So rigors are a clinical symptom or a sign if they are witnessed, characterized by feeling very cold. So the patient will feel cold and uncontrollable shivering. And it is usually followed by fever. So if you notice a patient who have rigors and have normal body temperature when you see it and examine it, so within the next few minutes, the patient will develop fever due to this is a response to resetting of the hypothalamic thermostat into a new setting temperature, which is yet not reached. So rigors will produce contractions of the muscles, and the contractions of the muscles will raise the body temperature to the new setting temperature, for example, 38. How investigation how we investigate a patient who you suspect that have an infectious disease. First of all, we have to confirm the presence of infection and identify the specific pathogen. And the most important one, identify its susceptibility to specific antimicrobial agents in order to optimize the therapy. And lastly, the extent to which a microbiological test result supports or excludes a particular diagnosis depends on its statistical presence. So these are the aims of investigation of infection. So you should confirm the organism and identify its specific pathogen. For example, staphylococci, which have many strains. For example, Staphylococcus aureus, legidensis. And we have to know the susceptibility in order to we can treat him by the optimized therapy. And the finding of this organism will mirror the clinical picture of the patient. So these are the general, non-specific markers of infection or inflammation in a patient to whom you suspect that have infectious disease. For example, the white cell count is usually elevated in many infections. Neutrophil and residual neutrophil, leukocytosis. Plasma C-reactive protein, which is mediated by interleukin 1. Interleukin 1 will raise the C-reactive protein that is synthesized in the liver, and also procalcitonin. Serum lactate. Cell counts in the urinary cerebral fluid. CSF protein and glucose. These are markers of inflammation infection but are not specific because the white cell count may be elevated in other non-infectious causes, for example, acute leukemia. So these also plasma C-reactive protein. It will be elevated in infectious and non-infectious causes. So keep in mind, if these are elevated, it may or may not indicate infection. The specific tests include direct detection of the organism by the method described previously. For example, microscopic identification of the a sample of a patient, or detection of the toxin, for example, in Clostridium difficile diarrhea, or using the more sophisticated methods, for example, nucleic acid amplification test using PCR. Nowadays, we use PCR for many infections and many viral or bacterial infections, for example, in HIV infection, or even in the Mycobacterium tuberculosis. And in the COVID-19 today, we use the nucleic acid amplification test. The famous one is PCR, polymerase chain reaction. Or we may use the culture of the organism itself, and at the same time we use antimicrobial susceptibility test. Another indirect way to detect an infection by using the host-specific immune response, for example, the antibody detection in a patient to whom we suspect to have, for example, measles. The diagnosis of measles is clinical, but we can diagnose measles by using the antibody specific to this virus, for example, IgM and IgG. And another example is hepatitis A infection. We can diagnose it by using, because it is difficult to have the virus culture from the blood. The easiest method is to do the host-specific immune response by identifying the immunoglobulin, IgM, in response to infection. Or by using another method, which is the interferon gamma release assay, for example, to detect latent infection with the tuberculosis, which we call the IGRA test, which is based on the interferon released from the lymphocytes of the host in response to past infection with Mycobacterium and tuberculosis. So we are not going to identify the organism, but we can identify the specific host response immune system, because IGRA, the interferon gamma release, is specific for tuberculosis, but not for example, another types of bacteria, E. coli or Staphylococcus aureus. So IGRA is highly specific for tuberculosis. And you have here, as you see in the slide, you have a homework. how to provide samples for microbiological sampling. So, for example, how to do a proper blood culture or urine culture. So you should able to provide me with the homework for this question, how to provide samples for microbiological sampling. So, antimicrobial susceptibility testing. One of the ways to identify organism by culture, and the most important one, to treat the microorganism successfully, you have to have antimicrobial susceptibility testing. If a growth of organisms in a culture is inhibited by addition of an antimicrobial agent, the organism is considered to be susceptible to that antimicrobial therapy. Keep in mind that the relationship between the in vitro antimicrobial susceptibility testing, for example, in the laboratory, and the clinical response is complex, which means that sometimes there are variations between the in vitro and in vivo testing. So an antibiotic may be resistant in vitro, but when administered to a patient, it may show some response. So this was explained by the red line. The relationship between the in vitro antimicrobial susceptibility testing and the clinical response is complex. And as you know from your previous year or this year, that the susceptibility testing is often carried by disease diffusion. This is a famous method to define the antimicrobial susceptibility. What about the epidemiology of infection? How infection is common or rare in the society? The communicability of infectious disease means that once a clinician has diagnosed an infectious disease, potential exposure of other patients must be considered. So if we diagnose a patient with hepatitis A, for example, you have to have screening for other individuals who have exposed to this virus. Or in a patient who developed Mycobacterium tuberculosis, infection of the lung, pulmonary tuberculosis, you have to know which patient, which human have been in contact with this person. So you have to trace the contact. And this is our basis for many communicable infections to be treated. You have to trace the contacts with the patient in order to break the chain of infection. So you have to control the disease. These are the symptoms which are in respect to geographical and temporal patterns of infection. Endemic disease. What do we know by endemic disease? Endemic disease has a constant presence within a given geographical or population, geographical area or population. For example, typhoid fever, which is called a disease, enteric fever. It is endemic in Iraq, for example, and it has a constant presence in Iraq. So this is an endemic disease. And there are many examples of endemic disease in Iraq. For example, Mycobacterium tuberculosis, brucellosis. What about emerging or re-emerging disease? An emerging infectious disease is only that has newly appeared in the population or has been known for some time, but it is increasing in incidence or geographical range. For example, the appearance of Vibrio cholerae in Yemen in the recent years, or the appearance of, for example, COVID-19 in Iraq, which is a new disease. So it is an emerging disease, and etc. So one of the domains for the chain of infection, the reservoir. What do we mean by the reservoir of infection? It is defined by any person or other living organism, environment, or combination of these, in which the infectious agent lives and replicates, on which the infectious agent is dependent for its survival. For example, human may be a reservoir for many infections. For example, Staphylococcus aureus which is maybe present in the skin. So human considered a reservoir for Staphylococcus aureus. For example, Streptococcus pyogenes, which are present in the throat of the human being. And the Clostridium difficile, the human may be a reservoir for this infection inside the colon. And the reservoir may be non-living. For example, surfaces that are, for example, the tables may be a reservoir for influenza droplets. Once the patient sneezes, these droplets will fall on the table, and the table, the plastic table or the metal table, will act as a reservoir. If anybody touches this surface and touches eyes, his or her eyes, or may insert his, for example, when he eats something, this organism will be swallowed and will cause a disease. For example, in Clostridium difficile. On the other hand, humans are the only reservoir of some infections, not the other reservoir, not other example. For example, animals. For example, measles. Measles, humans are the only reservoir of this infection. Whereas brucellosis, there are many reservoirs for this, of this pathogen, human and non-human. For example, in cows. So the reservoir of infection. Here, as you know, the famous cartoon, Tom and Jerry are quarantined due to measles. And this picture, in contrast to the scientific basis, that measles, humans are the only reservoir of this infection, and animals will not contract the measles. So this is a famous joke. Animal reservoir. The WHO defines a zoonosis. What do you mean by zoonosis? Zoonosis is a disease or infection that naturally transmissible from vertebrate animals to humans. For example, in brucellosis or in Q fever, due to Chlamydia psittaci, which is transmitted from animals to human. And there are many environmental reservoirs, for example, in water, surfaces, and etc. How the infection is transmitted from the reservoir to the human? There are many routes of transmission. For example, the respiratory route, the fecal-oral route, sexually transmitted infections between human beings, blood-borne infections, or direct contact, or via vector or fomite. The vector or fomite bridges the gap between the infected host or the reservoir and the infected host. For example, in malaria, the vector will be the Anopheles mosquito, will transmit the disease from human to human by mosquito bite. So the vector will bring the gap between the susceptible hosts. What do you mean by fomites? Fomites are inanimate objects such as door handles, water taps, and ultrasound probes, which are particularly associated with healthcare-associated infections, which mean that infection that occur inside the hospital or healthcare setting. The incubation period is the time between the exposure and the development of symptoms. So, for example, a patient exposed to an infectious host, a disease host, who have influenza, who sneeze in front of him. So you have to calculate the number of days till the second host will develop the symptoms. This is what we call the incubation period. And the period of infectivity is the period after exposure during which the patient is infectious to others. So this is very important cause of the period of infectivity, during which the patient may be infectious, but to have little or no symptoms. What about the healthcare-associated infection? These are examples of healthcare-associated infections. You don't need to memorize them, but you have to keep that every site has specific organisms in healthcare-associated infection. For example, temporary central venous line. These are the usual organisms that will cause infections. So if you have an infected venous line, you have to know the usual microbial agents that will cause such infection, which are usually the normal commensals. For example, Staphylococcus aureus, or whether it is positive or negative, coagulase negative Staphylococcus, or coliforms, for example, E. coli or Candida. So if the patient has temporary central venous, you have to think about these organisms. And in deciding to treat empirically, you have to cover these organisms. So the most famous organism is Staphylococcus aureus. What about one of the chains to break the infection is the prevention and control, which describes the measures applied to populations with the aim of breaking the chain of infections. This is the concept, break the chain of infection in order to control the disease. What are the measures used in infection prevention and control inside the hospital? This is important. How we can prevent infections in the healthcare setting. This is a homework also. But I give you a highlight. The most important concept is maintenance of good hand hygiene. Rule number 1, always wash your hands only when visibly soiled. For example, with the blood or feces. Otherwise, you can use an ethanol-based hand rub. Typically, the duration of entire procedure is minimum 40 to 60 seconds. And for the population, at least 20 seconds. How we can effectively wash your hands. These are described the methods. I know you are familiar with these methods for proper hand washing. So it will involve 12 steps, beginning with using the tap water and apply enough soap to cover all hand surfaces. Rub your hands side by side or one over the other. Backs of fingers is also important, which is when the organism may hide. And the most important also, that you have to make a circular movement in order to clean your thumbs. Rotational rubbing, backwards and forwards, in order to clean the center of the palms. Rinse your hand thoroughly with water, and you have to use a single-use towel, which is the most important one. If hand-operated taps have been used, use towel to turn off, and should not use your hand again to switch off the tap, because it will recontaminate your hands. So for the lay people, you have to wash your hands at least for 20 seconds. When you have to wash your hands, when you get home from work, when you blow your nose, sneeze or cough, before and after you handling the food. And the famous etiquette for cough or sneeze, you have to use either you cover your mouth with a tissue, or when you cough or sneeze, you have to use your inside of your arms, not your hands. So you have to cover your mouth and nose with a tissue or your sleeve, this sleeve, and not your hands, in order not to contaminate your hand if you don't have tissue. So what are the types of isolation precaution? This is also famous in order to break the chain of infection. Many organisms, for example, measles, have an airborne transmission. So how we can prevent this to break the chain of infection? Either we apply negative pressure room with air exhausted externally. So the patient, when a measles admitted to the hospital, this is very infectious, and you have to have a negative pressure room. Otherwise, if you don't have this facility, you have to use an anti-5 mask or FFP3 mask to avoid infections, because it's highly infectious. And these nowadays, we use these masks in order to prevent COVID-19 infections by using such tools to break the chain of infection and decrease the disease. What about the contact transmission? Either preferred in the room, for example, in a patient who have diarrhea, we have to apply contact transmission, either isolated in a single room and use gloves and gown for staff in contact with the patient or contaminated area. This is very important inside the hospital settings in a patient who have developed diarrhea. Droplet transmission, it's also preferred in a private room. And between patient and patient, you have at least 1 meter. And for prevention of droplet transmission, surgical mask usually suffice. Another way to control infection is to immunize the host. So when you have the susceptible host immunized against this infection, it will also control the disease appearance. And as you know, immunization may be massive, passive, or active. What about the guidelines of vaccination against infectious agents? This is an homework. This is a term, antimicrobial stewardship. What do you mean by this term? Which refers to the systems and processes applied to a population to optimize the use of antimicrobial agents. Nowadays, there are many misuse of antimicrobial agents in any patient with fever. An antimicrobial agent is unnecessarily prescribed, which may build up an antimicrobial resistance. So not every patient with fever you should prescribe an antibiotic, and this will create resistance. So the antimicrobial stewards describe the proper systems and processes to optimize the use of antimicrobial agents in respect to indication, the dose, and the type. And this is, by this slide, I will conclude my lecture. And if you have any questions, I'm happy to hear your questions. So if you have any questions, you can unmute yourself. Please unmute yourself.
دكتور الصوت يقطع واربع مرات من ثلاثه ما يصير صوت. شو ما افتهم حرفيا المحاضره بس قراءة سلايد. يعني 45 سلايد دكتور. كان مثلا نقدر نسوي بيانات فاصل سؤال او شيء واحد فهم.
If you have a question, please unmute yourself and ask me. Next week, okay, for the homework, you can upload your homework in the Google Classroom in the next week, and I will trace your homeworks in the Google Classroom. الصوت كان واضح بالمحاضرة؟
العفو دكتور، الصوت ثبت ما صار، صوتي يقطع والصورة هم.
I provide you with the lecture in the Google Classroom. You can download it. Okay, I will upload the record of this lecture inside in the Google Classroom.
بس دكتور ملاحظة، دكتور تسمعني؟